Then, as an example on what he's working, one of the elements of this kind of work is a multidisciplinarity. And then the main role of the Biomedical Technology Center we have created here is to be able to have multidisciplinary teams. If not, we couldn't move on this direction. So then this is one of the main elements. That is the reason that at the end we have created the center with a lot of joint labs with other institutions, because it is the only way to work. And this is another case with one company, BioD.
Okay, thank you very much, Gonzalo. Thank you. Yes, first of all, I would like to thank Gonzalo and the organization for giving me this opportunity to present Optical Detections, which is a very, very, very small company. And as you will see, in this case of study, of course, I will be more focused in the case study of BioD more than in the science behind. But in any case, if you need further or you have a further question later of the presentation and so on, I will be available during the event. So, okay, just starting by saying that BioD, of course, is a very small company. And the outline of my presentation will be just to show you what it's Bio, which is a very, very briefly, which is the study of the history of this small company. But also with a general vision for a global market. This is our idea, and I will just roughly explain you which is the technology behind, as I told you before. And finally, I will just comment about which is our commercialization strategy and also the products that we are developing right now. Okay, this is some information about Bio. Bio is an UPM, technology-based company, born from the UPM program and Actua UPM. Actua UPM, it was the second innovation prize in 2010. And it's in the...
Actua UPM is an entrepreneurship competition program at the university.
Exactly, that one here, you have here the information. And it's just devoted for a very large sector, which is in vitro detections, with an holistic approach that I will comment on this later. And okay, probably this slide summarizes what I tell you right now. So okay, Bio just born from the science. I mean, from the basic research, is based on top rank and high impact articles. And this science has been converted to technology. Some of them has been patented right now. That we have 2 patents and, for the science that we consider that can be explored. And finally, after this development, we are trying to convert this knowledge to final products. So we have an independent valuations, and also we are right now participating in many industrial possibilities. So just in order to show you which is the history, we are starting with the first idea, and then we prove the concept, and we release or we submit the first patents. And then we participate in the UPM program, as Gonzalo said. I'm sorry for the incompatibility of the PowerPoint. And then we create Bio. So after some legal and financial assessment and marketing, then we go to supposedly the next step, which is searching for private investments. After that movement to the private investors, we go to venture capital, angels, and others, and then we consider that for the idea that we have, that is to create something for a long term, the venture capitals were not probably the best option for us. So after that, we think about which is our strategy, and our strategy was just to create a very, very important IPO strategy, and then goes to the industrial investment more than venture capital, which is just thinking about some certain business ideas, which is perfect, but was not exactly the idea that we have. And after that, we have been developed the technology more in order to find jointly with industrial partners the final market. This is our strategy. And this was not okay. We thought not in this way at the beginning, but after thinking about what we want, we are looking for RTD or research technological development for a very long time. So in that case, the venture capital of our venture capital experience was not as good as we thought. So after that, okay, we have participated also in the European Commission for some trials or some model for how we can explore the technology, and this is, you can find an interview that was done by the European Commission. And after that, we thought about, okay, which is really our strategy and how can, from the very small company, explode some devices in the market. So firstly, we have to know which is our market. So the market is very large, but also there are a lot of competitors. So the technologies that are right now established in the market are most of them based on lateral flow, which is the typical pregnant test, which is a low price but with a low performance. And the other gold standard, I would say, is the LISA, which is semi-quantitative, have a lot of sensitivity with very high sensitivity, but also is very high. So the cycle in which bio we consider has to be moved is to create something, to create IVD devices, in vitro diagnostic devices, that can be as good as ELISA, but with the low price of a lateral flow. So after that, we have been just with this, having in mind this focus, we create this kind of technology because it's a different technology in order to be more focused in this idea. In order to know exactly which is a more general global market, we have to distinguish something that this is our idea, this is our strategy, four vectors of application. The first one, from the point of the transducer, is what kind of molecules can we detect? I mean, from the bacteria, virus, proteins, hormones, ADN, toxins, and very small molecules, which is a very important challenge. And the other vector is sensitivity. How can we achieve a good or the needed sensitivity that is different in order to detect these kind of molecules? And this is just from the point of view of the transducer that we are developing. But also, something important is how can we read these transducers? And in this term, I think that we can analyze that the market is just divided or split it in multiplexing, how many tests can be done in a single test, from the typical single qualitative test, which is that one based on lateral flow, to the multiplexing, many diagnostics in a single chip, to high throughput screening, more related for pharma industry and very large laboratories. And the other is the portability. I mean, which is the person or the user that will have to use our technology? From the final user, that sometimes, that probably so far right now for many applications, and for the typical professionals that can use our point of care devices. So yes, this is the global picture. This is what we are thinking in Biot. And then this is our main concept for developing our strategy. So our goal is just to create cost-effective technologies in order to make the access to the diagnostics more universal. The second is just create point-of-care devices in order that these diagnostics can be efficiently goes to the place where we have to carry out the diagnostic. Multiplexing more for the capacity, as I told you. And finally, the sensitivity in order to detect properly the molecules that we want to detect. So, giving in mind this, then we will focus in two patents. The first one is just based on our transducers that are based on nanotechnology, are networks that we call vessels of nanosensors. And therefore, this is very important because we are not using of chemistry for our detection. It's label-free detection, it's direct detection, and this reduces the cost extremely. And the other one is, okay, we have very good transducers, but we need something to read what those transducers are giving us. So for that reason, we patent another important technology for us, which is the readers, the point-of-care devices. So based on two patents, we have right now developing our products. So just also say that currently Biot is in the business center of here in Montegancedo from the Technical University of Madrid. And also we have a synergy with my research group, which is in the Center of Biomedical Technology. And Biot is just more focused right now in the product development. And here you can see also the strategy. Biot is looking or just collaborating with industrial partners with defined specifications Then we adapt our technology for those specifications, and then we make the commercializations together. So, in other words, from the industrial partner, Biot adapt this technology. We have right now contract with some industries right now in order to create jointly these products, and now we will purchase the biotechnology to these industrial partners, which are already established in the market, and therefore they have the capability of commercializing this technology. Right now, Biot is here. We are right now running several products in the market, and here you will see some examples. The first example is with Birsel. Birsel is a company that has more than 50 years old, and we are developing with them infectious diseases products that we call the brains will be Birbiopoc. And then we are collaborating with this, and we are detecting dengue, rotavirus, syncytial virus, and influenza. And you can see here the model that we are right now testing in the facilities of Birsel. The other product is called Tear Monitor. One of the advantages of our technology is that we are capable of measuring several markers with label-free in very, very small amounts of sample, in 1 microliter. So this applies directly for dry eye pathologies. So then we, Biophthalmics, have discovered some biomarkers, and now we are developing together, and we have tested just very well, that we are developing together some diagnostic for ophthalmology for dry eye diseases. And you can see here some publications. And another very important sector is agriculture. So one of our more sensitive sensors was chosen in this very big project in Europe in order to test the real monitor of very small toxins in marine water, and also for agriculture. Now, thanks to this European project, we are developing we are adapting our technology to this new market. And okay, I can say that the first results has been very, very, very successful. And finally, we are right now under negotiation for pathogens detection in water. Now I cannot give you here the industrial partner because we are just under this negotiation. And finally, then also with the collaboration in the Center for Biomedical Technology, we are collaborating right now in order to design a trial for test allergy and food intolerances. This product will be in the future AFIPOC, and here you can see a portfolio of our technologies. So, okay, very briefly, this has been the history of Biot, and if you have any question, I will be delighted to answer them. Thank you very much.
Okay, thank you. We are running 15 minutes late, but if you have any question to Miguel or Francisco del Pozo, please feel free. Yes, sir.
Thank you and congratulations for your presentation. So my question is very simple but very general. Do you think Biot is a company to be launched in Spain?
Okay, Anglo-Saxon world is probably much better, or other model or other countries are or have another strategies or more kind of support for this kind of initiatives. Yes, probably yes, we are looking only for biotechnology. For other places in the world probably are much better to launch this kind of initiatives.
Which
for
places?
us, yes, but for us I think it's also a challenge to try to do it here. So this is why we want to create something for a long term, and also because we believe that our technology will success in the future.
Don't you think it's difficult to compete with companies that attract $10 million in a first round investment?
Yes, probably this is a very good question. Of course, we cannot compete with this. But what we think internally is that if you create something that is good, independently of the competitors, you will success in the market. Even more, what we are thinking is that if someone copy our technology, then we are in a good track.
Anyway, we are trying to keep here in this campus the capability to have these kind of companies in close association with research groups in our research centers. I understand that it's just only from commercial purposes should be a challenge. But I think it's also our responsibility to provide the ecosystems like Glenn Osaka mentioned before, that we need to create the right ecosystems to provide the basis for having both things. Close connection to research groups to be able to develop the future technologies here, and also the capability to support those kind of companies to reach to hit the market. How to do that? Well, step by step.
Step by step, exactly.
Thank you very much.
Thank you.